Wisconsin is in a public health emergency due to the COVID-19 pandemic. That declaration was made earlier today by Governor Tony Evers. There are currently 8 cases of coronavirus confirmed in Wisconsin, and our surrounding states have seen an increased number of cases as well.
Well, at 5, we sat down with the director of the Eau Claire City County Health Department, Liska Giese, who will be joining us in just a second. She confirmed there are no active cases of the coronavirus in Eau Claire County, and currently the risk of you contracting it is low.
However, it is highly likely the coronavirus is already having an impact on your life. The stock market has tumbled, cleaning supplies are being cleared out, events being canceled left and right, and some businesses are bracing for a big economic impact.
Well, let's continue that conversation that we started at 5. And with us is Liska Giese. Liska, thank you for joining us this evening. Well, let's jump right into it. So what should people in Eau Claire be doing today to prepare for a potential outbreak here?
Yeah, I think many things they can be doing. We certainly don't want them to panic. We do want people to pay attention to basic hand washing and taking care of themselves and staying home when they're sick for any disease, but certainly as we start seeing cases here. We also want people to be, as an individual, checking our website, the health department website, for current information about what's going on in the community and using that as a tool to be ready for when things change.
Okay, so on the other side of that, what should people not be doing?
Yeah, we really are encouraging people not to panic. This is not in our community right now. We don't want people to be canceling events, canceling their plans for individual things. We do want them to think about making sure that they stay safe and they stay healthy.
Well, Italy is a hot spot for the virus right now, and according to the U.S. National Library of Medicine, their medical staff to patient ratio is among the highest in the nation. However, it has been widely reported that Italy has run into a shortage of medical staff, supplies, and hospital beds. So if the virus were to hit here, could we see something similar?
Sure. We've been working really hard in this community and across the U.S., but certainly in Wisconsin, to plan for events like this. And part of that planning is thinking about how, when we get cases, we really make sure that the spread of that is as closely controlled as possible. That's one of the things we do in public health, and that's what's happening in Wisconsin already with the few cases that we have. That means that we are anticipating that, yes, we will see spread of disease, but not to the extent that we're seeing it in some other places. And our healthcare partners are working diligently to be ready for that. Probably the biggest thing we're worried about is that the worried well, or those that are sick but not really exposed to COVID-19, are going to show up at the medical system and overwhelm it. And so we really want to make sure that people are not doing that.
Okay. Now, a lot of events are being canceled left and right, as we talked about. What are the advantages, good or bad, of that as far as controlling the spread or affecting the spread of coronavirus?
We know that we'll likely be getting new recommendations around large community events coming soon in Wisconsin. We are really using those kinds of tools, large community events where a whole variety of people are coming into them, where they may be coming from different communities, to say we shouldn't really spread disease in those ways right now, whatever the disease is, COVID-19 being of most concern. Most community events in this community in Eau Claire, and certainly things that are happening that are residential events, are really not a risk right now. Those are things that really, we don't have the COVID-19 in our community right now. We aren't concerned about that.
Now, Liska, with all of these cancellations, do you expect maybe flu and cold cases to drop?
Yeah, I think anytime we wash our hands more and have some distance from each other if people are sick, absolutely. We hope that things like influenza slow down.
All right, well, thank you so much again, Liska, for joining us this evening. This conversation is continued. If you missed our interview at 5 p.m., you can find that entirety on WQOW.com.
Now, during that segment, we talked about the symptoms of COVID-19 and what you should do if you start displaying them. Video of this interview will also be posted shortly to WQOW.com.